Today is September 12th, 2022, and I am here with Dr. Katherine Grimm. So, can you just tell me a little bit about yourself, where you grew up, and kind of what your upbringing was like?
Certainly. And just to let you know, my maiden name is Teets, Teets. When I graduated from Mount Sinai School of Medicine, it was under Catherine Teets.
Mm.
I was born in New Jersey. And when I was 18 months old, I developed chronic asthma, which I never, ever really outgrew. My asthma was fairly significant, so significant that my family moved to Colorado for 5 years because the doctors in New Jersey felt I didn't have anything else to offer. In the 1950s, the treatment for asthma was fairly primitive. I mean, it's much more advanced now than what it was in the 1950s. And in the 1950s, they also considered asthma to be a psychological disorder. So when we initially moved to Denver, my mother wanted to admit me to the National Jewish Hospital. And at that juncture in time in history, the National Jewish Hospital thought that children with asthma should be separated from their parents for a very significant period of time because of the impact of the parents causing the child's asthma. It was sort of called a parentectomy. And when I found out that that's what they would do, I was very upset. And so my mother relented, and I did not go to National Jewish as a patient. Now, of course, it's a very well-respected institution. It has a relationship with Mount Sinai, the pulmonary division, but the treatment of asthma has changed a lot. So my experience in Colorado was a very interesting life experience, but it certainly did not do anything to help my asthma out. So we lived in Denver. We lived in the Rockies for 2 years in a mining town, and we lived in the Great Plains and really ranching country. And my father was a teacher, and he had some job instability, which was really not related to his teaching skills. It was related to small town politics, which is why we moved around the way we did. But we finally moved back to New Jersey in 1958 because my mother had found a doctor there that was supposedly good with the asthma treatment. It turns out he was not that good. And I continued to have really very bad asthma until the middle of my junior year in high school. And my mother took me to an internist that she had heard about, and he gave me an asthma medicine, which I had never previously been given before. And my whole life changed as a result of that one physician. And I always really greatly appreciate what he did. But when I was a junior in high school, maybe when I was a sophomore, I'm not exactly sure when. And you have to remember that there were not that many women in medicine at that point in time. And I remember that I was staying home sick one day, and we did not have a TV, mainly because of my father's philosophy about TVs at that time. But he did get one later on. But we didn't have a TV while I was in high school. And so we got magazines. And so one of the magazines we got was Life magazine. And so I was looking at Life magazine, and in the centerfold of Life magazine was a picture of women physicians from the Women's Medical College of Philadelphia. It may have been called the Women's Medical College of Pennsylvania, but it was located in Philadelphia. And it was that point in time that I decided that I wanted to pursue medicine. So I was originally going to become a teacher, which was the typical career aspiration for a girl then. But I thought that kids need to feel well in order for them to learn in school. And so that's why I ended up deciding to go to medicine. So I subsequently went to Muhlenberg College, where I was a chemistry major, and I was pre-med from the very beginning. So I ended up going to Rutgers Medical School, which was a brand new medical school, just like Mount Sinai. Both Mount Sinai and Rutgers I think they started in 1966, because I graduated from college in 1967, and I was in the second graduating class at Rutgers Medical College, and I was also in the second graduating class at Mount Sinai. And so there was a number of two-year medical schools in the United States. University of Hawaii was one of them. Brown was another one of them. And so all of us had to transfer to a new school after our 2 years at Rutgers. And I had originally wanted to go to Hopkins because I had heard that Hopkins was more liberal about women in medicine. And I actually applied to Hopkins 4 times. The first time I applied to Hopkins was when I was a sophomore in college for their 5-year program. They had I think it was a BA MD program. And like many times, you get put on the wait list, but it doesn't mean that you get in. The second time I applied to Hopkins was in my senior year in college for the 4-year medical program. And the third time I applied to Hopkins was when I was finishing up at Rutgers as a transfer student. But our class size at Rutgers started out as 16, and there was only me and another girl in the class. Her name is Dr. Sandra Moss. And she and I both transferred to Mount Sinai because our class at Mount Sinai was all transfer students. And our class size was, I think it was 35. It was either like 33 or 35. And so Sandra and I were roommates, although she was married and her husband was a professor at Rutgers, so she did not stay in New York that much. She went back and forth between New Jersey and New York. Dr. Moss is now a medical historian, and she's published and has done very well in the academic field. I mean, she was originally a nephrologist, but she retired from clinical medicine and became a medical historian.
You talked about, moving from New Jersey to Colorado, back to New Jersey, and I'm guessing anyway, and correct me if I'm wrong, that your schooling must have been a bit interrupted because of some of the moves and because of your significant asthma. I'm just wondering if you could talk to that a little bit.
Well, when I was in first and second grade, I missed a lot of school because of my asthma. And I remember when I was in second grade, I think I missed like 62 days of school. And I really wondered whether I would get passed or not onto third grade, but I did. And then when we got to Denver, I was in 2 different schools in Denver, an additional school up in Gilman, Colorado, and then another school in Ellicott, Colorado, and another school in Simla, Colorado, and then back to our old home. We rented out our house in New Jersey, so we came back to our own home, and then I went back to the school where I had originally gone to first and second grade. So obviously there was a lot of disruption because when you move around a lot like that as a child, you wonder who your friend is going to be. It's sometimes a little bit scary when you're the new kid on the block and how are you going to make friends? But, particularly in our last year of Colorado, I was so sick. And in retrospect, my parents did not know this, but they had rented a basement apartment, and basement apartments are lethal for asthmatics because of mold and because of things like, I don't remember seeing roaches, but basement apartments are just really, really bad for asthma. So then when you feel sick, you don't have that much time to have friends. So I always had, like in high school, I always had like one person to eat lunch with, our church sponsored a high school prayer group before school started, and I would go to that, so I had some friends from there. One time when I was having an attack, and I don't remember how old I was, but this was after we had returned to New Jersey, so it must have been when I was at least in 8th grade or higher. I remember sitting in my bed and feeling so terrible and wondering whether it was even worth living anymore. And I came to the conclusion that it was worth living. Not being able to breathe is a terrible feeling. And so this doctor really had a miraculous effect on my life.
Do you think it was that doctor that you met your junior year of high school that influenced your interest in medicine, or was your interest in medicine something that existed prior to?
It existed prior. His name was Dr. Paul Johnson. He was a huge help to me. So my college years, I went to Muhlenberg College, and I went there because my math teacher in high school had said that Muhlenberg was a really good pre-med school, which it was. And so I went to Muhlenberg College, and I was really very, very happy at Muhlenberg College. It was a very positive time in my life. And so when I ended up going to Rutgers, I actually commuted to Rutgers from home. But because we were a small class and because we were a new school, there was so much enthusiasm on the part of the teachers that I felt my education there was absolutely amazing. I really felt that I had a very high level of education. And when I got to Mount Sinai, which was also in their second graduating class, the professors were so enthusiastic about the school that I also thought that I had an amazing education. So by this time, I had sort of fallen in love with New York, but I needed to apply for residencies. And my mentor at Mount Sinai was Dr. Horace Hodes, who was chairman of pediatrics at that point in time. And I wasn't completely sure what I wanted to go into. And so Dr. Hodes was very encouraging to me about going into pediatrics, and he promised that he would give me a slot at Mount Sinai. But he had been originally at Hopkins. And so once again, this is my fourth time applying to Hopkins. At this point, I wasn't really sure I wanted to go to Hopkins now after,
Right.
attempt number 4. But I knew that it was a good institution. And I knew that if I didn't get into Hopkins, I had a place at Mount Sinai. So I ended up applying to Hopkins, and lo and behold, I was accepted into their residency program. And I was at Hopkins for a total of 6 years. 3 years as an intern and resident. Then I came back to New York to work at Mount Sinai for 1 year. And then I went back to Hopkins to be their outpatient chief resident, which is sort of akin to being in charge of the emergency room. And then I was on faculty for 2 years. And I was very gutsy back then because they had never had a woman as an inpatient chief resident at Hopkins, despite their fact that they were more favorable about women there than maybe some other places. But I did not think it was fair to me to move to Baltimore for 1 year to fill in that slot and then not stay. So I negotiated a faculty position. So if they weren't going to give me the inpatient chief residency, I negotiated a faculty position, and I also negotiated what my title should be. So then I moved back to Hopkins, and I stayed on at Hopkins for a total of 3 years. And while I was at Hopkins, one of my mentors at Mount Sinai passed away, and that was Dr. Robert London. Dr. London was in charge of the emergency rooms, and he was also in charge of ambulatory care. And he died during a cardiac bypass. And Dr. Hirschhorn at this point was chairman of pediatrics. Dr. Hodes had stepped down. Dr. Hodes was still at Mount Sinai, but he was no longer chairman. And Dr. Hirschhorn reached out to me as to whether I would come back to Mount Sinai to be in charge of the pediatric ER. So that's what I did in 1978. And then over time, my job at Mount Sinai expanded, and I became vice chairman of the department. And I also was in charge of ambulatory pediatrics as well as the emergency room, as well as the pediatric emergency room. And then, I was very active with the medical school, with the curriculum committee. I was active with Savvy as I became medical director there. So, I had many different jobs at Mount Sinai. Then the chairmanship changed because Dr. Hirschhorn took a terminal sabbatical, and Dr. Suchi was hired on as the new chairman of pediatrics. And at that time, I was trying to recruit a faculty member to work for me at the New York Center for Children, which is where I am right now. While I'm talking to you, I'm at the New York Center for Children. When I came back to Mount Sinai, I inherited the child protection piece. So Dr. London had been very much involved with child protection, and so I just took that over from him. And so doing child protection had really become part of my professional life, really since the mid-1970s. Going back to 1997, when Dr. Suchi became chairman, he wanted to recruit this physician from Yale to take over ambulatory pediatrics. At that time, Dr. Suchi didn't have any control over the emergency room because the pediatric emergency room had become part of the Department of Emergency Medicine. But he did have control over, what my job would have been at Mount Sinai in the Department of Pediatrics. And at that juncture, I decided that I would take the job at the New York Center for Children, and I've been doing that ever since then. So when I came here originally, we were doing forensic evaluations of children who were suspected of being abused. And so I worked here like 20 hours a week for years. And this allowed me then to be grandfathered to take the child abuse pediatric boards. So, I really believe that God opens and closes doors in our lives, because if it hadn't been for Dr. Suchi, I probably would have stayed on at Mount Sinai full time.
Well, and it sounds to me like you've had kind of a combination of both your own grit working in your favor, and then also, like anybody's life, kind of some serendipity as well. I'm wondering if I can just go back to your time at Rutgers and then your time at Mount Sinai. I'm sure you've been asked this question many times. But I'm wondering, just tell me what it was like being one of the only females in a large sea of males. What was that like for you, both at Rutgers and then at Mount Sinai?
It was actually fine. I never felt prejudiced against or anything like that. I mean, I enjoyed working with the guys. You know, we were like buddies. It was just a nice working relationship. And because both of the schools were small at that point in time, it made it perhaps even easier to work together. And, you know, in those days of medical training, both at Rutgers and Mount Sinai, laboratory experiences were very important. Now they're a lot less important. I mean, the medical students today would be appalled that we dissected a dog as part of our physiology course. So as a result, you know, we worked a lot together because there had to be a team effort. And it was always very congenial. I mean, I can't think of a single negative experience I had either at Rutgers or at Mount Sinai, either with fellow students or with faculty.
When you were finishing up medical school and looking towards your next opportunities, did you feel like the same opportunities were afforded to you that were going to be afforded to, or that were open to your male counterparts?
I would say yes. The only thing that I sort of, in retrospect, I'm glad it didn't happen, but it was always traditional at Hopkins that the outpatient chief resident became the inpatient chief resident. And why I was not offered the inpatient chief resident, I don't know whether it was a gender issue or not. And
Mm-hmm.
as it turned out, being on the faculty for 2 years was probably much better for me. But that was the only time that I can recall right now in which I felt that maybe there might have been a little bit discrimination because
Mm-hmm.
all the jobs that I have came to me. I did not apply for a single job. You know, there was a lot of opportunities that I had at Mount Sinai with the medical school and within the Department of Pediatrics. These were things that I was not vying for, but they came to me. So I feel very blessed.
Did you have any sense of where you might be headed with your medical career and then where you ended up?
When I was in medical school at Sinai, you know, the Department of Community Medicine was a very strong department. And I was always very much interested in social issues. And that probably
Mm-hmm.
comes from my background. You know, I was raised in a conservative Christian community, and helping other people is sort of part of love your neighbor as yourself. So I was always interested in social issues. I was always interested in poverty. When I was doing my community medicine rotation, you know, I did home visits as part of my rotation. Not all the students did that, but I did home visits with visiting nurse, for
Mm-hmm.
example. When I was at Hopkins for my internship and residency, there wasn't that much focus on child protection at that point in time. But then when I
Mm-hmm.
came back for that 1 year working with Dr. London, who had gotten so involved with child protection that it just,
Mm-hmm.
you know, I gravitated to it. It wasn't something I was
Mm-hmm.
planning on. But for anybody
Mm-hmm.
who does emergency room work, it's part of the package. But I mean, Dr. London, you know, created a Manhattan Inter-Hospital Child Protection Committee, which I continued when I came back to New York.
Mm-hmm.
So I would say that when it comes to child protection issues, that Dr. London was probably the major person who
Mm-hmm.
influenced me in that field.
What would you tell a young 18, 19-year-old looking to get into, well, maybe not 18 or 19, right? I guess they'd be more in their early 20s, thinking about medical school. Any advice or wisdom you would share with them?
I
Mm-hmm.
really think it's an amazing profession. I mean, being in medicine is hard work, and you have to realize that it's hard work, and you're dealing with some very tragic situations. Medicine is challenging in that respect, but I think it's an amazing profession. And I think for some people, being a physician is a calling, and I would encourage
Mm-hmm.
them.
Did you feel like it was a calling for you?
Yes, I did. So I was very glad I had the opportunity because there used to be like a quota of women in medicine. And that's one of the reasons that I was so interested in the Women's Medical College, because that was a medical school specifically for women. When I was at Muhlenberg, I only applied to a few medical schools. And I thought that I would have no trouble getting into Women's Medical College. And so what happened is that on the day of my interview, I had taken the bus from Allentown, Pennsylvania to Philadelphia. It was pouring rain. I had looked on a map and I saw the Women's Medical College was within walking distance of the bus station. And I came from a fairly poor family. So the thought of using a taxi cab, just did not occur to me. So I get to Women's Medical College and I think I must have looked a little bit drenched. And then to make matters worse, I was interviewed by a psychiatrist. And so the psychiatrist wanted to know why I wanted to go into medicine. Because the routine question back then was anybody in your family ever in medicine? Which the answer was no. So I told the psychiatrist about my chronic asthma as a child. And I think in retrospect, he was probably raised with the concept that asthma is a psychological disorder. Because I eventually did get accepted at Women's Medical College, but not immediately. And I was surprised because I had done well academically. I also had good extracurricular activities at Muhlenberg. I was very disheartened that I was put on their waiting list. But I think it was because of that interview with the psychiatrist.
It's so interesting. Well, thank you for sharing that. So just before we wrap up, is there any hopes that you have for Mount Sinai Medical School or Mount Sinai as the institution?
I have an elective and I get a fair number of medical students that do the elective as well as residents. Both the residents and the medical students do my child abuse elective. So that has given me an opportunity to meet a fair number of students. I think Mount Sinai is a nurturing institution, but I think Sinai has tried really hard to have a good curriculum. I do think that people try hard to make it really a wonderful medical school experience. I don't have very much to compare it to because I've either been at Mount Sinai or Johns Hopkins. And when I was at Johns Hopkins, I was a resident. And I have to tell you, when I got to Johns Hopkins, I found out that I had had experiences that the medical students there had not had. So in a way, I was ahead of them in some respects because of my experiences at Rutgers and at Mount Sinai. So, in retrospect, I'm very grateful that my life took the path it did and that I didn't get into Hopkins earlier than what I did.
I meant to ask you earlier, I'm assuming yes, but were your parents both supportive of you going to medical school?
They were very supportive. My father was very proud. I mean, my mother originally thought that I should be a teacher and that my brother should be a doctor, but my brother's an architect and I'm a physician, but they were always very supportive.
And just my last question, is your asthma well managed now?
It's still a problem, actually. They used to preach or teach that asthma was a reversible airway disease, but it's not really reversible. So I have scarring and chronic changes because, when I was growing up, I didn't get state-of-the-art treatment for my asthma. And as my lungs have gotten older, it is bothering me actually more. So, I see a pulmonologist regularly. I have a pulmonary physiatrist that I see, that's a rehab doctor. But I'm very grateful I'm able to function, grateful I'm able to have this conversation with you without being short of breath. But I do have challenges with this. And, I'm 77 and I'm still working, so.
Thank you so much for making time to speak with me today and share your experiences. I really appreciate it.
That's okay. It's been my pleasure. Thanks a lot.
Thank you so much.
Okay,
Take care.
you too.